The three subtypes of narcissistic personality disorder, the definition and range of this often misunderstood condition are complex. Narcissistic personality disorder remains a somewhat controversial diagnosis in the DSM-5. There are concerns about whether the diagnostic criteria used to define the disorder fully capture the nature of the condition and instead unduly stigmatize aspects of it. Some of the terms that define that condition highlight aspects such as antagonism and lack of empathy, which, even if present, may characterize the condition as potentially morally culpable and unsympathetic. But research lately has attempted to focus on subtypes within NPD that may help both clinicians and lay people understand the variability of the condition and identify better ways to manage and treat it. Two review articles in the American Journal of Psychiatry note that NPD may be a heterogeneous category that encompasses three major subtypes, with varying degrees of clinical severity and prognosis. 1. The grandiose overt type. This type is considered to have the highest severity of poor interpersonal and psychosocial functioning, and higher comorbidity with other psychiatric disorders, including other personality disorders and substance abuse. They may present with more anger and hostility than the other types. Despite more illness severity, people with this type of NPD are less likely to present for help and engage in treatment. In some severe cases, individuals with this presentation may encompass the malignant narcissist subtype. 2. The fragile, vulnerable, covert type. This type is considered to possibly present more often for mental health treatment with higher comorbidity with depressive and anxiety disorders. These individuals have more issues with vulnerability to criticism and fluctuation between high and low self-esteem. NPD may actually be missed as a core source of their symptomatology, as they do not necessarily present with the overt grandiosity and lack of empathy as some with the disorder. But they still may have underlying traits of covert expectations of superiority or recognition and remain preoccupied mainly with their own sensitivity and perceived failures. 3. High-functioning exhibitionist type. This type is less likely to have psychiatric comorbidity and may not necessarily meet the functional impairment criterion for NPD, except during periodic crisis or unexpected failures, such as losing a job or undergoing a divorce. They appear to be outwardly successful and generally maintain their ego stability, but they still maintain an essential NPD personality structure. Issues with entitlement and self-centeredness may lead to interpersonal issues and exploitative, empathetic behaviors. Issues with entitlement and self-centeredness may lead to interpersonal issues and exploitative, empathetic behavior.